It's the Todd Ortloff Show on News Radio KONP. Now, here's Todd.
Hey, welcome to the program. Going to spend the first part of the show today talking about a real need in our area. I run into people that have this issue all the time, and that is they can't find a dentist. We talk about they can't find a doctor. Well, finding a dentist is almost equally as hard, or at least getting onto a waiting list for one here. Well, one group locally is trying to solve that somewhat, and that is NOHN. That's the North Olympic Healthcare Network. And yes, we always talk to them about other types of healthcare things, but they do dentistry as well. And the reason we have some folks in today to talk about that is that they've expanded. They've brought in a couple of new dentists, some practitioners, and we have one of them here with us. Jon Eyre, Jon Eyre is here, who's just been hired and has been brought on board since about January. Jon, thanks for coming in. It's good to see you.
Thank you, Todd. How you doing?
I'm doing just great. We're going to talk with you in just a second about where you came from, kind of what you're doing. But first, we're going to talk with the dental clinic manager, and that's Autumn Casey. Autumn, it's great to see you again. Thanks for stopping by.
Yeah, thank you.
And I think I just kind of set that up. There is a real need. I know that most people don't. If you've got a dentist, you don't realize this. If you're new to the area trying to get a dentist, you realize there's a real problem.
Yes, yeah. Pretty much everywhere in the community right now, whether it be private practice or clinic like ours, you're looking at about a 3 to 6 month wait to get established. So the need is pretty large.
And with that, anyone who has an acute dental problem, that's a big issue too as well. I mean, because these are, some, although you can get some emergency services, but, to get something taken care of so it doesn't come back to be a problem.
Yes, and not every office is equipped to take walk-in patients.
Right.
And we do have walk-in services available Monday through Friday at our office.
Now, we've talked in the past on this program about NOHN and its overall view, I guess, of healthcare. And this fits in right with that. This goes in, there's vision now, there's behavioral health, and there's dental health, too.
Yes. Mm-hmm.
And tell us a bit about the importance of that, because I think people don't realize, and we'll also get the dentist to weigh in on this, the importance of dental health. I mean, this is a big thing. A lot of bigger problems begin with dental issues.
Yes, absolutely. And so we're just trying to incorporate it into that whole body healthcare model. And so, it might start out as a toothache, but it can grow into something much larger. And so we want to make ourselves available before it grows.
Exactly. Yeah, right. Exactly. Okay. So, Jon, let's talk with you. Jon Eyre, who's just on staff, as I mentioned, since January or so. That said, I mean, that is a big problem, isn't it? Sometimes folks, because we tend to just muscle our way through a toothache.
Yeah, of course.
And that's a problem.
Yeah, no, absolutely. I mean, there's so many associations between healthy oral health and healthy heart health. The teeth are part of the body. It's kind of the entrance to the body. So, what you put in and everything. So, there's not much worse than a toothache too. So we're kind of here to stop everything kind of before it gets any worse.
All right, we'll talk a bit more about how the clinic model works over there, but I want to talk with Jon just a bit about your history and how you got here, what you were doing up to this point, and what landed you in Port Angeles. You are a Washingtonian, by the way.
Yes, sir. Right? Born and raised down in Tacoma, Washington. Went to dental school at the University of Washington, so I've been in Seattle for about past 4 years. Always had a passion for community health, giving back to the community, via outreach. So when I, just graduated last year, I looked at a bunch of locations, found NOHN, absolutely fell in love with the model, with the mission statement. Loved the area, knew it was going to be a place for us. So wife and I moved up, by mid-January. Yeah, loving it ever since.
We talk about the need when we talk about doctors because about rural care and stuff. I don't know, in dentistry, is that an issue as well? Is there an emphasis in trying to get dentists to get into general practice in a rural area?
Absolutely. I mean, it's our calling to go where we're needed. So when you hear that patients can't get in, they can't be seen at dentists, there's just not enough providers out there. Of course there's a calling, and it's always been a personal mission statement of mine. And when you find a company whose mission statement kind of aligns hand in hand with your own personal one, it's just a great place to be.
To flip that around a little bit too, I mean, you have to make a choice when you're coming out of dental school as to where you want to land, what you want to and this is a little bit of a different maybe approach than most would take.
Yeah, I mean it's definitely different than maybe a corporate dental practice or a private practice. Maybe what we can do is a little bit more limited on some of the higher end things, but as far as seeing patients, for exams, cleanings, and just getting people seen that may not be able to go into these private practices, that's where I feel like the work is really good for us.
You've been at it a couple of months now, at least. What have you noticed? What do you see happening here and through your practice so far?
So far, I've just loved the community that A, I work with, and B, I get to work for. The whole team at North Olympic Healthcare Network is awesome. All the providers, all the assistants, it starts even at the front desk. Everyone's kind of all on the same page, all on the same team. And then I love when patients come in and they really get that sense, it's no joke that people don't necessarily enjoy coming to the dentist. And it's really cool that, like, as a group, we can kind of put these anxieties, these fears aside and give them the best care that we can provide. And I do think that we make good headway with a lot of patients.
All right. I have a number of friends who are dentists. So I got to ask this question because they didn't end up. That wasn't what they planned to do. Yeah. So how did you end up? Have you always wanted to be a dentist, Jon?
So that's funny. I get this question a lot. Of course not.
Right.
I always knew I wanted to do something in healthcare, something with medicine. And it's funny, my grandma was the one that actually made me pursue dentistry. She had a neighbor and she was like, "Hey, Johnny, you got to come shadow him to see what it's all about." And I was like, "Grandma, I don't think that's for me." But then one day, I finally gave in. I shadowed Dr. Quigley down in Oregon, and immediately it was kind of like an epiphany, aha moment. It's so much medicine built in with kind of handiwork, craftsmanship. You get to work with your hands on every case, yet you got to have the medical knowledge of as a provider, as a doctor. So to me, it's the perfect blend between artwork and medicine.
All right. So then I have to ask you this: when you're not working on people's teeth, what do you do? What's your hobbies? What do you like to do outside of the practice?
Fitness is a big thing. Love going to the gym. Got to stay strong. Especially being a dentist, you're sitting in that posture all day. So it's nice to have a healthy body. Besides that, I'm a nerd through and through, Todd. I love video games. I love TV.
Right.
Love reading books, but fitness would be first.
All right. Welcome to the community,
Appreciate
by the way.
it.
And I want to swing back. We'll get back with Jon in just a moment. Autumn, back to you. Just a bit about how the clinic is run. As Jon mentioned, it's it's kind of a holistic approach there, even in the dental clinic.
Yes. Mm-hmm.
So take us through kind of what's different. Maybe some of us are familiar with going to a professional commercial dentist office. Is there something what might we find that's different at your place?
Well, our services are a little bit more limited than a private practice. We're general dentistry. We don't do much above and beyond extractions. We do a little bit of endo, but not much. Right. We are trying to focus on helping the Medicaid and the underinsured population a lot, trying to focus on getting pediatric population seen. These are patient populations that have access a lot more restricted to them than most others in the community. So a lot of services that are offered through Medicaid, that's where we try to focus what we do.
Now, because of your association through NOHN and how that's set up as a federal clinic and all of that, does that make it pencil out better to serve that community more so than perhaps maybe a traditional private dentist's office might?
Yes, yeah. The dental clinic operates under the FQHC model, as does the rest of NOHN. And so, yes, we try to focus there, and there's little to no services for the adult Medicaid population in the entire county for dental. So, yes, we really try to focus on the Medicaid population.
So here you are. Here's an outreach, I guess. But how do you let folks know? Because there's that sounds like a tremendous number of folks that can't get service, but they could through you.
Mm-hmm. Well, we are here trying to let them know. COVID hurt us, and limited staffing hurt us. So we are now at a point where we have an opportunity to let people in the community know that we're available and let them know about our services. So we're just trying to get the word out there in any and every way possible.
So what is the process for getting treatment at your clinic? What should folks do?
So they can certainly call the clinic and look to get an appointment. If you're just looking to get an established and you don't have a problem, then there's a wait list that's rather long, but we're chipping away at it at a pretty good pace. If you're in pain, then you have the option to utilize our walk-in policy, and you can come in Monday through Friday from 7:45 to 8 o'clock, and we will find what spots we've got available in that day's schedule, and we will see you that day. We can't guarantee same-day treatment, but we will see you and evaluate you that day.
So if you're don't have a dentist, you've got some pain going on, 7:45.
Yes.
Show up at the clinic.
Yes. Yes. And if you're not an established patient with North Olympic Healthcare, that's okay. You can still come in and we will see you. And if you have no insurance at all, we will work with you there as well. We have a sliding fee program. All right. I would not let finances get in the way of taking care of your oral health.
How many are working in your clinic now? What do you have staff-wise?
We have 4 dentists and 1 hygienist currently.
Okay. What's your capacity? I mean, ultimately, what do you hope to have in that clinic at some point?
Well, in this particular clinic, we've got 7 chairs. So we're looking to add probably another hygienist. And then after that, we're just going to be bursting at our seams. So the sky's the limit from there. But in this particular clinic, probably not too much more.
And I should have asked you this earlier. Your clinic is located
933 East 1st Street in our extended services building, which is the one across from Fast Burrito there by Walgreens.
Okay. Kind of next door to First Race Car Wash in that little spot there. All right. So that's the place to go. John, I'll go over to you. We mentioned kind of some limited services. Take us through, though, what you can do for somebody. Maybe somebody comes in, you get them, I'll use the word triaged, I guess, for lack of a better term. But what if they need some more advanced, treatment at some point? What happens at that?
Of course. So there's a couple of ways to look at this. If someone comes in, they wake up over on Monday over the weekend, they just had some gnarly tooth pain. This is that walk-in service that we were talking about at 7:45. We can try to get you in on the schedule somewhere. That's the triage part of it. We'll take imaging and then all the diagnostics that we need to make a good diagnosis. From there, we can decide kind of the best treatment option to go, whether the tooth is restorable, put a filling, maybe the tooth needs to be extracted, or maybe it needs a higher level service such as, a root canal or a crown. It's kind of a couple of hoops we want to jump through if the patient is not an established patient. And Adam, you can correct me if I misspeak here, but if it's an established patient, then there's different sliding scale fees and proof of income, I believe, that we can show to kind of help finance some of these procedures.
We do have some limited some limited root canals and crowns. But we can refer you out if we have.
And that was my next question.
That was
if it gets beyond what you can do,
Exactly.
You try to find some place for folks to get to.
That was option number 2 is the referral.
Right. But the main thing is you're trying to get people taken care of acutely.
Yes.
Because I know a lot of folks who can't get to a dentist. That acute thing becomes a chronic thing for a long, long time. So
it's a whole lot easier to deal with in the acute phase as well. So,
John is here. We didn't. We actually were going to have the other new provider with us, but he's stuck in a procedure of all things right now. So tell us about Zachary Bibb.
Dr. Bibb is the other dentist that joined us. He and Dr. Eyre started on the same day, and he came over and joined us from a corporate office in Spokane. He's been in dentistry about a year longer than Dr. Eyre, and he's just plugging away as well. But yes.
Literally as we speak. Right?
Yes, the procedure ended up being a bit bigger. He was able to help the patient, which was awesome. It was a little bit bigger than we expected.
We'll have to get him in at a different point.
Yes.
Yeah, when he's not doing his job, right?
Yes.
Well, I think it's a tremendous service. People, I think, need to become more aware of it and let folks know that NOHN is there with dental for, especially for folks who are, on Medicaid.
Yes.
And that's a lot of people in our community. And I know I've talked to some. They just get established easily because that's their pay plan.
Yes.
And it's tough, and this is another option for them. So best thing to do if you've got an acute problem, you don't have an established dentist anywhere or with this clinic, show up at 7:45 any weekday, right? Is
Monday through Friday.
Monday through Friday? They'll try to get you worked in that day.
Yes.
Otherwise, if you want to get established, get on your list. They're chipping away at that as well. So
Yes.
eventually you can get yourself established, at least in your clinic, too.
Yes.
Okay. Autumn, great to see you again. Thanks for coming in.
Thank
Autumn
you.
Casey, she's the dental clinic manager at NOHN. And Jon Eyre, new dentist in town.
Yes, sir.
John, good to see you.
Nice to
Thanks
see
for
you.
coming on
Thank you,
down.
Todd.
And we're going to take a quick break, and we'll be back with more on our program right after this.
This is the Todd Ortloff Show on News Radio KONP.